going to ask an even more specific question because this is an interesting case. I'm going to refer to my notes here because this is something that you guys worked on. The Clinton Health Access Initiative was involved with this new partnership with Pfizer and Cipla. Am I saying that right? And the American Cancer Society also to provide discount cancer treatments in Africa. This seems like something that would be like a no-brainer. Like there's a need, there's a real need. What was hard about that? What can you tell us about how that came together?
I think that the recent announcement of the work that the Clinton Health Access Initiative has done and is continuing to do with not only Pfizer, Cipla, American Cancer Society, but the American Comprehensive Cancer Network, which is a network of either fully kind of focused or largely focused oncology cancer hospitals here in the United States, is certainly what we think is kind of a testament to what we try to do best, which is to be the catalyst to bring together kind of unlikely partners to just change how people think about markets and then how markets function. So in some of the focal countries, upwards of 90% of diagnosed cancer patients, so not even kind of suspected cancer patients, but diagnosed cancer patients weren't able to access treatments that you would be able to access if you were diagnosed with the same type of childhood leukemia, for example, here in the United States. And we know that the drugs, the 16 drugs that are part of this first wave are already kind of in generic iteration. And so what Pfizer and Cipla have both said is that because of kind of the greater guarantees of volume, they're dropping their prices significantly. Many of the kind of 16, which hopefully is just the first wave of drugs, we'll see pretty quickly the prices drop between 50 and 90%. Wow. And the reason that's so important is not only does that enable more of those things to be bought and then hopefully thoughtfully deployed, particularly in places where they have been able to invest in building capacity, and they do have, not specialized, but they do have oncologists and they have cancer nurses, but it also frees up then kind of other parts of those dedicated budgets to buy more of the expensive drugs that aren't part of this. So hopefully it enables kind of two things to happen, an increase of equity for kind of the set of patients for whom this will be immediately relevant, but also enables kind of patients who have cancers that are not included, hopefully yet, but not included yet in this, to also access treatments because governments will now be able to make those investments that they couldn't have afforded before. And the other part of this is kind of what the American Comprehensive Cancer Network has committed to do, or has now done, which is to kind of rewrite the protocols in a lot of these countries so that they're much simpler, that it's much clearer kind of which drugs would be applicable, but also when that wouldn't be true, so that hopefully everything is easier from an administrative standpoint, so that the whole system gets more efficient and more equitable.